I don't know how to hand express my milk. Sometimes people say that to us because they've heard from other people that they should try hand expression. But they aren't really sure what that means. Or they maybe heard about it or learned it a little bit in the hospital, but they didn't really get a chance to practice it very much. And hand expression is so important because it can help you get milk out even if you don't have a latching baby or a breast pump. So, hand expression, really important technique. It's like any other skill. It takes practice, takes a little bit of trying things out and seeing what works. But I'll show you really quick what it looks like. So, when you take your fingers to the breast, you want to put your fingers not too close to the nipple and not too far back on the breast either. But there's going to be a sweet spot or a place sort of in the middle where when you squeeze the breast tissue gently, you're going to notice that it doesn't really change the way the nipple looks. It doesn't pinch it, it doesn't move it, it doesn't really change anything. So when you find that spot where you're compressing the breast tissue, then you've got the right spot. And when you do that and you hold a cup or a spoon underneath it, you'll be able to collect drops of colostrum if it's very early since your baby was born, or if it's a little bit later. Here's another small container that you would want to use if you were getting colostrum out of your breast. Later on, you might want to use a cup or an open top bottle. So you would hand express, basically put that little pressure on the breast, and as milk is coming out, you capture that in your container. And then when the milk stops flowing as fast, then you simply move your fingers around and you find a different spot. On any spot that you can find where you can gently compress the breast and get milk out, you're doing it right. So for every person, that magic spot, that magic place where they're going to compress, it's going to be a little bit different. For some people, when their fingers get too close to the nipple, they can see it pinch, they can see it change. And for other people, if they're starting way far back, it can actually hurt a little bit. So it's really important that, like anything else that we do with the breast, we use a really gentle pressure, gentle enough that it works, but it doesn't hurt. So if somebody else is helping you with this, or if you're doing it for yourself, it should never hurt when you're hand expressing. You should never feel like this is really uncomfortable. If you're a bit engorged before you start hand expression, can really help to do a little bit of really gentle massage, just gentle fingertips over the skin without compressing it, just bringing those fingertips back across the skin, back towards your body, just for a couple of minutes until things start to soften up and the circulation starts to go. And what that can do is actually get the circulation going so that things are already moving around and flowing inside your breast. And when you begin to hand express, you can start to get some milk out. If you're trying to hand express and you're not really seeing anything come out, you may need to do more massage, or you may need to check out our video on reverse pressure softening. So hopefully that's a helpful hand expression video, and that you can use that anytime you need to get milk out. So that could be you forgot a pump part at home and you're away from your baby, or your pump isn't working, or you need extra milk for your baby while you're in the hospital. Any reason at all to hand express, you don't have to have a breast pump in order to get milk out of your breasts. If you need help with this, if you want to talk about it more, you're not sure when to use it or exactly how to do it, even after this video, it's totally fine. We are happy to help. Just hit that connect button and we'll be in touch.